Hi, good evening, everybody. Hello. My name is Jessica Shipley. I'm one of the registered dietitians and diabetes educators with Stanford Health Care. Thank you so much for attending our diabetes care program wellness group today. We're really glad to have you here. Just before we get started, a couple logistics. If you have any questions during our presentation, please feel free to add them to the Q&A section. That's located on the toolbar at the bottom of your screen. Elaine, our speaker, will be answering questions at the very end of the presentation, but feel free to go ahead and add your questions in and we'll keep track of those. This webinar is being recorded and will be posted on the Stanford Healthcare Library website under the Diabetes Care Program. Under that website, you will also find an archive of our previous webinars. I want to introduce you to our speaker. I have a pleasure for introducing you to Elaine Hon. She is a senior dietitian with over 15 years of clinical experience providing individualized nutrition counseling to patients. She's a certified diabetes care and education specialist and has a specialty in digestive health. Elaine received her Master's of Science in Clinical Nutrition at New York University and a Bachelor of Science in Biochemistry at Cal Poly in San Luis Obispo. She currently practices as a clinical dietitian at Stanford Health Care, where she counsels patients one-on-one and teaches diabetes education classes. In our presentation today, Elaine will be sharing tips with us on managing the gastrointestinal side effects of GLP-1 receptor agonists with the focus on nutrition and lifestyle interventions. Thank you so much for being here tonight, Elaine.
Thank you so much, Jessica. And thank you everyone for joining today. I'm really excited to be here to talk to you more about GLP-1s and the nutrition lifestyle interventions. There's so much good information right now on the benefits of GLP-1 receptor agonist medications, whether it's to improve blood sugar management or to help with weight loss or to also help with improving cardiovascular health. And so these medications right now have gained a lot of popularity and a lot of attention that it's my hope today to really talk about what the expectations are, like managing your expectations what are some possible GI side effects when you do take these medications, and how to use nutrition and lifestyle interventions to manage these symptoms. So let's get started. The learning objectives for today is first to identify the common gastrointestinal side effects associated with GLP-1 receptor agonist therapy with people with diabetes. And second, to implement lifestyle interventions, including eating behaviors and physical activity that may alleviate gastrointestinal symptoms experienced by people taking these medications. So first off, what is a GLP-1 receptor agonist? It is a class of medication that mimics the effects of our natural hormone, glucagon-like peptide 1, so GLP-1. The GLP-1 is a natural hormone that our body has, and it is released when we eat some food. So let's say when you eat maybe like a piece of bread, what happens is your digestive system starts breaking down the carbohydrate into simple sugars. Once that happens, now what's happening right here is that the GLP-1 hormone, which is naturally occurring in your body, it's going to tell your pancreas, hey, let's send out some insulin. And when the insulin is being released, it helps move the sugar out of the bloodstream and then into your cells, where then it can be used as a source of energy. So the GLP-1 hormone has many helpful roles. First, stimulating insulin release, like the example I just shared. So when insulin is being released, it actually helps lower the sugars in your bloodstream. The second role that it helps with is it helps suppress glucagon. So that's a hormone that's opposite of insulin. So that hormone, glucagon, it actually raises your blood sugar. So GLP-1 actually keeps it at bay, keeps it down. It also helps with slowing the rate at which the stomach empties. So then this can lead to a feeling of fullness and then a reduced appetite. It also increases satiety, which means that you're feeling full for longer, and then it reduces how much you're eating. So the GLP-1 receptor agonist is really important for many different reasons. The next thing I'm going to talk about are some of these FDA approved GLP-1 receptor agonists. These medications, I'm just going to briefly touch on it, but I want you to know that if you want a deeper understanding of these medications, our pharmacist Michael, he actually took a deep dive into these medications and explained a lot about it in a previous webinar. So we can put the link in the chat box of his webinar, so in case you want to view it and get more information, you can go into that link right there. So I'm going to talk a little bit about these different medications. The oral medication, Rybelsus, that is the only approved oral semaglutide and is given in a daily dose in a very small amount. The other ones are actually given by subcutaneous injection, which is either given daily or weekly. So the daily medications are Byetta, Adlixin, Victoza, and Saxenda. The weekly injections are Bydureon, Trulicity, Ozempic, Wegovy, and Zepbound. Because there's so much good data around the effectiveness of these medications, um, a lot of people are being started on these medications. And what I want everyone to understand when they get started on the medications, what are the potential side effects? So, the most common GI side effects, the most common gastrointestinal side effects are nausea and vomiting in the upper GI, and diarrhea and constipation in the lower GI tract. It's important to really understand that mild to moderate GI symptoms are not an indication that your treatment is going wrong. If anything, it is pretty common and it typically occurs in the beginning of treatment and it is dose dependent. I share this because I think often when you start a medication and if you're starting to feel uncomfortable or when you might think you're not tolerating it, you just stop abruptly. But I want you to understand that these are common and I'll go over some of the statistics as well. But if anything, if you're experiencing some of this can be common. I'll explain to you when it's not common too. And then I also want to go over what the least common side effects are: pancreatitis, gallbladder disease, and intestinal obstruction. So these are rare, but it is also important to make sure you share with your doctor before starting the medication if you have a history of any of these conditions. So I also wanted to go over a little bit more about the less common side effects. This is a table that includes 30 clinical trials that focus on the GLP-1 safety, so the safety of the medication. These trials concluded that the risk of gallbladder complications, so cholelithiasis, or acute pancreatitis, is associated with this medication for the symptoms generally low. What is reassuring, though, is that many of these trials included a large number of participants. So, for example, in the SUSTAIN program, in their clinical trials, it investigated the medication semaglutide and involved over 8,000 participants with type 2 diabetes. In the other program, the Pioneer program, it involved more than 10,000 participants, adults with type 2 diabetes in their clinical trials. And as you can see in the red box right there, the results are expressed as percentages of patients who, during the treatment cohort, had a complication at least once during the period of the study. And these studies, they were done for over a year long study, and some of them longer. But I want you to see it could be it's 0 to 2% or 0 to 1%. So it is very uncommon, but at the same time, definitely if you have a history of gallbladder disease, if you have a history of pancreatitis, definitely something is definitely worth telling your doctor to see if this medication is appropriate for you. So I still want to emphasize that most of these gastrointestinal side effects of the medications are going to be mild to moderate, and they do improve with time. So again, I'm going to show you this table, but this time it's a summary of the frequency of GI side effects in the same 30 clinical trials. So among the most common GI side effect is nausea. The results, when you see the numbers right there, they're expressed as percentage of patients who experience the symptoms at least once during the period of the study. The wide range, because you see like 15 to 24%, or you see 14 to 58%, is such a wide range. And I want to explain a little bit about that. I think it's dependent on the different types of trials, and I think it's dose dependent. So the onset of nausea is slightly more prevalent in the trials that were assessing for the safety of the medications. So take a look at the STEP program and the SCALE program. In the STEP program, you could see that the dose of the semaglutide is 2.4 milligrams being dosed subcutaneously once weekly. And then the percentage of nausea that was experienced was 14 to 58%. But if you look at the program right above it, the SUSTAIN program, the semaglutide dose was actually 1 milligram. So less than half of what was being dosed in the STEP program. It was also being dosed once weekly. And then the percentage of experienced nausea was 15 to 24%. So same medication, but the dose was higher in the ones with the participants who experienced more of the nausea. If you look at the SCALE program, the medication liraglutide, that was at a dose of 3 milligrams that was given subcutaneously once a day. Now compare that to the program right above it, the LEAD program. The medication was dosed, the same one, dosed at 1.8 milligrams instead of 3. And so you could see in terms of the range, it's higher for patients who are experiencing more nausea. It's being experienced more with medications that are at the same medication, but at the higher dose. So, nausea is the most frequent gastrointestinal symptom that arises at the initiation of a GLP-1 receptor agonist. The frequency varies among clinical trials. Like I explained earlier, the range could be 15 to 50%, but it ranges and it's usually dose dependent. Prevalence is higher during the first 4 to 5 weeks of treatment, and that's when gastric emptying is more significantly delayed. So what we see is about 25% of participants, they experience nausea at week 4. So 1 in 4 patients are experiencing this. But then at week 8, it actually lowers and it's actually about 15%. And it's only 5.5% by week 56. So what we see are that symptoms are mild to moderate. They disappear 8 days or less after onset. So over time, nausea is less experienced. Now let's talk a little bit about vomiting. Vomiting occurs at a frequency that usually ranges between 5 to 20%, and that is lower than that reported of nausea. The symptoms have been reported to disappear in 1 to 8 days. So here are some strategies to manage the symptoms of nausea and vomiting. I recommend eating small amounts of foods more frequently instead of having a large meal. Try not to skip meals, even if you're not feeling well, because an empty stomach can worsen the nausea. And foods to avoid, I would avoid high fat foods or fried foods. And that's because foods that are high in fat take a lot longer to digest and to break down in your system. And think about the medication that you're starting. The medication actually delays the emptying of your stomach. So when you combine that, the medication that already is slowing things down, and then eating foods that are really high in fat, and then the process of breaking it down also takes a long time, that can actually make it really intolerable, not feeling well, especially if you're already feeling nauseous or if you're experiencing vomiting. You want to avoid foods that have really strong odors or foods that give you gas. I suggest trying foods at different temperature, maybe cold food or foods at room temperature is a little bit easier to tolerate. Some people feel that like really hot foods, like really, yeah, just hot temperature foods, there's a smell to it, and then that can really make it not tolerable in a sense. A high protein diet is easier to tolerate, so focus on protein foods. And then at times when the nausea or the vomiting is really bad, then consider trying a liquid meal instead of a solid meal. So you can try like a light protein shake or a light smoothie. That might just be a little bit easier to consume than having like a solid meal. Eating bland foods or foods that you already know that will just keep your symptoms feeling much better. And make sure you drink plenty of fluids. If you tried all of those recommendations and you feel like you're still struggling, here are some additional strategies to try. If the smell of the food makes you really nauseous, then ask if someone else in the household can cook for you, or maybe you can prepare some food from the freezer. Open the window, open the door, make sure that the smell of the food kind of disappears. The other tip is try to drink liquids 30 to 60 minutes before the meal or 30 to 60 minutes after the meal. Avoid drinking at mealtime because that can also make you feel really uncomfortable. And at this time when you're not feeling well, you probably don't really want to eat. But again, I don't want you to skip meals and just have an empty stomach because nausea on an empty stomach makes the nausea worse. So when you're drinking any liquids, do this between meals and not the same time because you're likely not eating a lot. And I want to make sure that any food that you're able to take in are going to be nutrient dense and that you're going to get a little bit more bang for your buck. And so drink your liquids separately. So don't drink and eat the foods at the same time. And the last tip is don't forget to eat. You're not feeling well, you're probably not wanting to eat, but we don't want you to have an empty stomach. Set an alarm as one way to remind yourself to maybe have a bite or two of something. One thing I want to say is if you do have very severe symptoms of nausea and vomiting, and you've tried all these different types of modifications, definitely let your provider know to see if there's any adjustments that need to be made. Diarrhea, that's another common symptom, and the frequency of diarrhea varies among trials. They usually range between 5 to 25%. It can occur during the first 4 weeks of treatment, after which it actually decreases. So, some strategies to manage diarrhea: choose smaller but more frequent meals and try to eat something every 3 to 4 hours. Eat more bland foods like chicken broth or chicken breast, white fish, eggs, soft tofu, cottage cheese, smooth yogurt. Those are some examples of bland foods. And maybe you want to eat foods at room temperature because it can be better tolerated than hot or cold foods. Make sure you do talk to your doctor or your dietitian if you're being managed for renal disease, because sometimes if you are experiencing a lot of diarrhea and you are severely dehydrated, we will have to make some correction on your electrolytes. And so make sure you do talk to your doctor if you are being managed for renal disease. If you are very dehydrated, we may consider adding in some more potassium-rich foods and sodium-rich foods. So some examples of potassium-rich foods or beverages include coconut water, bananas, peeled potatoes, lactose-free milk or lactose-free yogurt. If you are needing to replace any of the sodium losses, you might want to add in like broth or soups, crackers, or pretzels. Limit any foods or beverages that can worsen your symptoms. So, foods that are high in fat, like the fried foods or heavy food or foods with a lot of butter, that can worsen the diarrhea. You want to avoid sugary beverages like sweetened tea, soda, and juice. dairy products during this time, as it may make it a little bit worse. And products with any sweeteners ending in OL, like all, sorbitol, mannitol, xylitol, maltitol, all of these that will include that can be making it very difficult for your body to digest and to feel good. You want to avoid beverages that have caffeine in it, such as coffee. Um, and then spicy foods, especially like I think spicy foods are so delicious, but if you notice that they do make your symptoms worse, that's when you want to limit it when you are having these symptoms of diarrhea. Next, I want to talk about constipation. Constipation is a really common side effect of GLP-1 medications because the medication already is slowing down your digestion, which can lead to your stool moving out very slowly. And so I think that constipation can occur more frequently, but what the studies are showing is that it's in a range of 4 to 12%. But then there are definitely some trials that reported a prevalence of up to 25 and 35%. We have noticed in the clinical trials that the onset can be in the first 16 weeks of treatment, usually during the first 28 days. The symptoms have been reported to last longer than those of the other symptoms that was discussed, the nausea, the vomiting, the diarrhea. So constipation lasts a little bit longer, and the median duration is 47 days. One thing I just want to kind of drive home to people to understand is like, what is constipation? Um, if when you take this medication, likely you're feeling full and you're not able to eat a lot of food. So when you don't eat a lot, you're not really able to poop a lot, right? So if your normal baseline is pooping or having a bowel movement every single day, but now you're having a bowel movement once every other day, or maybe you're just not having large bowel movements and it's a lot less, you you're likely not constipated. You're just having a little bit less, you're eating less, so you're not able to have the same type of stooling as you used to. If you are someone who's used to having a bowel movement, like two bowel movements every day, and now you're doing it once a day or once every other day, you might not be constipated. So I don't want you to think just because you're going to the bathroom less than before that you're constipated. Um, Constipation generally means passing fewer than 3 stools a week or having a very difficult time passing the stool. So I don't want you to get confused because I was um, when I was going through the studies, I was kind of surprised that diarrhea was considered at a higher range or more frequent than constipation because in real life when I'm seeing patients and this is with discussions with my colleagues, other dietitians, we hear constipation a lot more than diarrhea. And I do think that it's important to understand what is constipation and if you're going to the bathroom less, and I'm talking about bowel movements, than what you're used to, that could also just be normal because you're eating less. But constipation generally means passing fewer than 3 stools a week or having a very difficult time passing stool. That being said, if you are having constipation, I want to give you some strategies on what to do. So, first, start with increasing a little bit of fiber. Likely you're not eating a lot of food, and when you're not eating a lot, you're likely not getting a lot of fiber. So, what I want you to do is be very intentional. Every time you eat, make sure that you do have a little bit of fiber in your food. So, gradually increase the fiber foods. Include fresh fruits, include some vegetables, you can include some legumes. So, that could be kidney beans, chickpeas, lentils. And if you want to keep the gas at bay, soak the beans first and then dump out that water before cooking it. Don't use, if you're trying to make like a bean or lentil soup, don't use that water that you just soaked it into the soup because then it's not going to help. Add some wheat bran or ground flaxseed to yogurt or cottage cheese as little ways of sprinkling in some fiber into your meals or your snacks. As you're increasing your fiber, make sure you stay really well hydrated. So drink lots of fluid. Um, Something you can also try is changing the temperature of your fluid. Maybe drinking a warm glass of water in the morning can also help. Sometimes a warm or hot drink like water with lemon or an herbal tea can help stimulate your bowel movement. The next thing I want to talk about is optimizing your bowel habits. So consider using a step stool. Some people have used something called like a squatty potty, but you can use any step stools that you want. Try resting your feet on a low stool and raise your knees above your hips. This position can help move your colon into an ideal position to have a bowel movement without straining. Um, you can also try to create a routine that I call like a sit schedule. That's where you sit on the toilet 30 minutes after eating, regardless if you feel the urge to go. You're just going to go to the toilet and you're going to do this the same time every day for 5, 10, 15, 20 minutes, however long that you feel like you need to. But just don't sit there longer than 20 minutes. So that's the sit schedule. When you're sitting, you want to make sure you're relaxed. So the deep breathing is something that can be helpful to relax you. Sometimes deep breathing is also called belly breathing or diaphragmatic breathing. So you can look into that as well if you want to learn more of the techniques. Abdominal massages can also help because they can stimulate muscle contractions that help with your bowel movement. So, a popular technique is called the I love you massage, which involves tracing the letters I, L, and U on your abdomen with some gentle pressure. And then that can help stimulate the muscle contractions. And also physical activity. I think you can't really have any nutrition webinars without talking about exercise. Physical activity, if you're being active, the recommendation is be active every day. This will help with motility. And some people actually find it helpful to be active first thing in the morning. So now let's talk about the I love you massage for constipation. Okay, so this is something that physical therapists they can show this technique or they work with their patients different things that you can do, and there's lots of different types of massages for constipation. I thought this one was a little bit easier to understand. So using your two hands, and you can do this laying down or standing up, and some people do this in the shower too. But you can start with using your two hands by forming the letter I. So you're going to do I first. Moderate pressure from the left rib cage all the way down to the left hip bone. Do this 10 times. So you're going to be moving your hands up and down 10 times. So you're forming the letter I. Then the next letter is L, also using moderate pressure. Go from your right rib cage, swing it all the way across to the left side, and then down to the left hip bone. So it's an upside down L. Do this 10 times to help stimulate the contractions. And then the last letter is U. So you're going to use from your right hip bone, go up to your right rib cage, across to the left rib cage, and then down to the left hip bone. So you're making an upside down U. Do this 10 times. So it's an ILU, the I love you massage. And so this can actually help stimulate muscle contraction, and maybe this can get you going. So I recommend creating a bowel regimen. So you can start with eating something and then drinking warm water or some sort of hot fluid. Then perform the bowel massage, like the I love you massage, or you can choose a different type of massage. You can look this up online too. And then try the sit schedule. And this is, you just go on the toilet, regardless if you need to go or not, but you do this the same time every day. Um, and then you try to relax. So use the deep breathing techniques. Do this the same time every day for a set period of time, no longer than 20 minutes. Maybe you just want to sit on there for 5 minutes, 10 minutes, 20 minutes, but no longer than 20 minutes. And then you can consider trying Miralax if this is not helping, or discuss other options with your doctor. Physical activity. We talked about physical activity helping to reduce constipation. I think that's really important because regular exercise can really improve a healthy blood flow to the intestines and can help with your digestion. But something else that's important is it can help preserve lean muscle mass. So these medications, while it's helping you manage your blood sugars, some of them can lead to rapid weight loss. So if you're losing weight fairly quickly, you want to make sure that you're hanging on tight to your lean muscle mass. Um, and so I believe that the physical activity is so important as part of your lifestyle maintenance, something that you want to continue doing. Try core exercises, exercise like sit-ups, crunches, planks. These stronger abdominal contraction can help move the food through the digestive tract. The bending, the twisting of your torso can increase the pressure on your intestines, which helps move the poop along. And then try yoga. Yoga is a really great exercise for constipation because it also affects the blood flow to the intestines. Since it involves bracing, bending, and twisting of your core, this exercise also emphasizes tapping into the parasympathetic nervous system, and that helps relax and calm you. So remember, in order to go use the bathroom, you want to be very relaxed. So there are some specific yoga poses that can help with reducing constipation. There's something called the supine twist, cobra pose, and child's pose. So the supine twist is a yoga pose that's performed when you're lying down on your back and you gently twist your spine by bringing your knees to one side. The cobra pose is a yoga back bend that opens your chest, stretches your shoulders, and really strengthens your back. It involves lifting your chest off the ground while keeping your legs, hips, and feet on the floor, often with a slight bend in your elbow. In child's pose, this one's my favorite. It helps relieve stress and it can stretch the lower back and open the hips. What it involves is kneeling and sitting on your heels and then folding forward, resting your forehead on the ground. So try these different types of yoga poses to see if this helps with some movement and getting a little bit more flow to your intestines. So I talked about the benefits of physical activity. So it can help with reducing symptoms of constipation. It can also help preserve lean muscle mass. And I just think it's an important component for long-term weight maintenance. The American Heart Association recommends 150 minutes of movement or activity a week. So you want to aim for 30 minutes 5 days a week. 30 minutes might sound like a lot. And so, what I want you to understand is it doesn't have to be in a full 30-minute of activity. You can do in increments like mini sessions of 10 minutes 3 times a day. And if even 10 if 10 minutes 3 times a day is too much, any type of movement is going to be better than none. We want to make sure that you're moving, include daily movement to help. Aerobic exercise is also beneficial. The intensity of your exercise can be individualized. So, this could be leisurely walking, it can be brisk walking, like you're walking with a dog, jogging, running, dancing, using the elliptical, swimming. It can also be cycling. It can also be non structured exercises like gardening or household chores. So, whoever your family members, your housemates, they're going to love you if this is the type of exercise you choose to do. Sweeping, mopping, vacuuming, washing the dishes, washing the car. These are all movement, aerobic movements. Um, they're just non structured exercises, but including daily movement is something that's highly recommended. So, overall, I have some nutrition and lifestyle tips to recommend. One, it's to eat a balanced meal, to prioritize protein foods to keep you feeling satiated, incorporating fiber to help with bowel movements and keeping you consistent, um, And then also eating smaller portions more frequently. That can also help with the nausea and vomiting. So, eating a balanced meal is something along the lines of looking at this plate right here. You want to make half your plate non-starchy vegetables. So that could be your spinach, your kale, your carrots, could be cucumbers, eggplants, all sorts of vegetables. That's the vegetables is going to provide you a lot of fiber. And remember, we want every time you eat, there's going to be a little bit of fiber in your food to help with the constipation. You want to make a quarter of that plate whole grains, and then the other quarter of it being some lean, being some lean protein. Protein's so important in preserving your muscle mass as well. Now, if this plate looks like it's too much food, you don't have to eat a whole plate full of food. It could be a smaller portion of what you're eating. You're just prioritizing the vegetables more, and then you're prioritizing the protein and having some of the whole grains. It could be a smaller portion, but the proportion of the food, how I'm suggesting it, half of it being mostly vegetables, a quarter of it being lean protein, and the other quarter being whole grains. So we want to prioritize protein-rich foods while you're on a GLP-1 medication because it's essential for preserving muscle mass, maintaining blood sugars, and keeping you feeling full for a lot longer. Examples of good protein foods are eggs, chicken without the skin, so less fat, fish. You can also do pork and beef, but choose the lean cuts. You can also choose tofu, so plant-based proteins, tofu, nuts and seeds, or the legumes like beans, peas, and lentils, and quinoa. The nice thing about these plant-based protein foods, they're considered a mixed nutrient food. So it actually has protein and it also has fiber. So it has the benefits of both. And then you can also take a look at some dairy products like cottage cheese, Greek yogurt, cheese, and milk. Those are good sources of protein as well, and also have some good source of calcium. Then let's talk about prioritizing the fiber. So fiber is going to help with managing any potential side effects of constipation, and it also can enhance satiety. There are two types of fiber. There's soluble and insoluble fiber. Both of them can help with the constipation, but they work in different ways. The soluble fiber will add a bulk to your stool, and the insoluble fiber can speed it along the food transit and prevent constipation. So, some examples of soluble fiber apples, bananas, barley, and oats. Examples of insoluble fiber whole grains, vegetables, wheat bran, and legumes. The thing that I want you to really take away from this is not really thinking about, oh, is there enough soluble fiber? Is there enough insoluble fiber? The best thing to do is just choosing foods that really came naturally from the earth. If you choose an apple, and I know apple is primarily soluble fiber, but it also has a nice balance of insoluble fiber. The apple itself, when you look at the white fleshy part, the inside of the apple, that's the soluble fiber. That's what's going to add bulk to your stool. The skin of the apple, that's the insoluble fiber. And that's what's going to accelerate the transit. Like it's going to make you go poop now. It's going to move things along. If you choose more like packaged items, you don't know if you're going to get more soluble fiber or maybe it's isolated and you're only getting insoluble fiber. So the nice thing is when you choose more foods that are natural, grown from the earth without all the extra packaging, you're going to get a balance of both soluble and insoluble. And finally, I want to make sure that you do eat smaller portions and increase your mealtime frequency. This can help prevent a large fluctuation with your sugar levels. And I also recommend not skipping meals. I see it too often when I'm working with my patients one-on-one. They eat one meal a day. They're not feeling well or they forget to eat. They're not hungry and they're eating one meal a day. But I recommend not skipping meals and maybe just eating like every couple of hours. And it doesn't have to be a large meal. It could be a small couple bites of a few food. Or, like if you think about like eating a sandwich, if you can't finish a sandwich for lunch, what you can do is at the 11 o'clock time, eat half that sandwich and save the other half of that sandwich for your mid-afternoon snack. So it's just smaller portions. You don't have to eat your usual portion. You'll just eat a smaller amount, but make sure there's protein in it, make sure there's some fiber in it, and just make sure you eat small amounts of food multiple times throughout the day. I would avoid eating one large meal or two large meals. You can see on here also the two plates. I recommend using a smaller plate, using smaller utensils, because the idea behind this is that you're not going to eat the usual amount you were eating before. You're going to be eating less. But the portions or the proportions of the food, the focus is on the protein, the focus is on the vegetables for the fiber, and a little bit of the grains. So we talked about different strategies right now for different types of symptoms you may experience for nausea, for vomiting, for diarrhea, and for constipation. I'm hopeful that some of these tips that I shared with you can help you along your journey. And I just want you to understand like the point of doing this today was to make sure that you understand there are going to be likely some symptoms that show up. And because there's so many great benefits with this medication, my goal is for not for patients to discontinue or to stop taking this medication because they're not feeling quite so well in the beginning. And so I just want you to know if it's mild and moderate, and it takes a little bit of time and it does go away. If you've tried these different strategies and it hasn't improved your symptoms, that's definitely a time to be in communication with your provider for any possible adjustment to your treatment plan. Thank you so much. That's it that I have for today.
Thank you very much, Elaine. So we do have quite a few questions, Elaine. Are you ready for us to go ahead and ask you the questions?
Absolutely.
Great. So for the audience, there is a Q&A box, just as a reminder. If you have any questions that you have, feel free to add those to the Q&A box, and I will ask them to Elaine, and we can hear her response. I'm going to summarize a couple of the questions. I see there's a variety of questions asking about any comments on outside of using some of the suggestions you discussed related to constipation. Is it okay to use some of the over-the-counter or prescription-related options to help manage the constipation? And do you have any comments on those?
Yeah, so I think first, trying all these different lifestyle or nutrition um, strategies is always recommended first. I actually think a lot of my patients are dehydrated. So make sure you definitely drink enough fluids, more than you actually think you need, because if you're not feeling hungry, you tend to not even drink much. So that's what I see first and foremost for constipation. So, um, drink fluids. That's the first thing I would do. But definitely, if you've tried all the different type of strategies I've mentioned before, Miralax is another one that you can consider because I think it's safe and you can use it every day. But definitely, we have here at Stanford, we have a lot of providers. We have our pharmacists, our doctors, who are also very capable and very wanting to also help too is like some of the over the counter supplements. And I think that is something that is worth exploring as well. And they're safe to use.
Do you have any comments on with some of those over-the-counter constipation options? There's various things like the powder form or the gummy forms. Do you have a suggestion on which one or which form might be better?
But like if one thing that comes to mind right now is like a Metamucil supplement. I recommend the powder form of the Metamucil supplement because it also encourages you to drink more water. When you do like the teaspoon or tablespoon of the supplement, you have to really mix it well in 8-ounce water. Whereas if you take the tablets, I believe you have to take 4 or 6. I can't remember the number right now to get the same, like the equivalent of that powder form. And so if you are doing the powder form, that actually it makes sure that you're drinking plenty of fluids. So I like that one more.
Yeah, great. So on the theme of fluid, I think we're hearing a lot about, yes, we need to be really well hydration. There were some comments in here, some others saying, yes, that definitely is me. Do you have any recommendations on how much fluid we might need per day?
Yeah. Okay. So that one, like to give a blanket statement, I don't usually give a, like a blanket statement, but at the same time, I like to say drink until your pee is like clear. I don't think that's the right. That's not really a number. I think a formal way of saying is like 8 glasses of water, 64 ounces a day to kind of start with. But just make sure that the color of your urine is not concentrated. We want it to be more light color, light lemonade, or clear. And everyone's a little bit different because, especially, you know, if as it gets warmer and you start perspiring more, you're going to need to make up for some of the losses that way.
Thank you. Another question talking about protein and constipation. Is it okay to eat a protein-rich diet with constipation?
Yeah. Okay. So I think if you're not on this medication, um, it's so much easier to eat a lot of food and a lot of protein. When you are on this medication, your appetite is reduced, and how much you're eating likely is not going to be an effect of you're not overdoing the protein to actually constipate you. If anything, the protein is a big priority. And when I say protein, I'm thinking more about making sure because often our patients, there is a statistic, and I think Michael goes over it. He went over this in his webinar for each class of the medication. How much weight is lost and the percentage, and also the percent of A1C that's being lost or lowered while on these different type of class medication. When you are losing this much weight, what we are seeing in the clinical trials is that people are losing a lot of weight and some people are losing muscle mass. It's unclear to me if the weight loss is what's contributing primarily to the muscle loss or if it's the medication itself. And so I actually think rapid weight loss is going to contribute to muscle loss. And so if you are unable to eat so much, you need to prioritize protein. Some people I think have told me I'm eating protein. I'm eating like a small piece of toast with like a little tablespoon of peanut butter. Yes, the peanut butter is protein, but what you're getting is maybe 6 or 7 grams of protein in that meal right there. That's not actually enough protein to help preserve your muscle mass.
Yeah, thank you. And then also another question, similar, kind of going along what you were just talking about with the muscle loss. We have a participant who asked about the muscle loss related to these medications, and is there any evidence or research showing how effective it is with increasing protein or exercise or both? And what would you recommend?
Question is if protein and exercise is going to help with preserving muscle mass. Is that what?
And or both.
Yeah, I suggest both. I don't think that you can just do exercise alone, and I don't think just eating protein alone will preserve muscle mass. You will have to do both. Um, what do I want to say about that? Um, it becomes like the exercise. I really want to hit this home. Exercise is so important because if if you're taking this medication to manage your blood sugars and there's some benefits of weight loss as well, if you start losing weight and you lose a lot of weight at one time too, you you may on the scale be thinner, but you might not be strong. And I have seen people who have become weak, even though now their BMI is in a good place. They have become weak and they can fall, especially if you are older. It's definitely a concern. We don't want our patients to become skinny in a way, right? Become skinny and weak. If anything, you're taking this medication to help with decreasing any risk of comorbidities and decreasing, keeping your A1C in a really good place, getting your weight in a good place, but you want to make sure you stay strong. So exercise and eating protein both are important.
Yes, thanks, Elaine. Another question is just a clarifying question about whether it's good to have fluids with meals or not at meals.
If you are having these symptoms of nausea and vomiting, you want to separate them so it's not at mealtime because then you're not going to be able to eat so much. And when you are nauseous or when you are, just not feeling well, if you're not eating much, it can worsen your symptoms. So I would like for you to still stay hydrated, but do it between meals.
Great. And then we have another question about the hydration is what about IV liquid products that can be purchased over the counter for hydration or something like a Pedialyte or a Gatorade?
Okay, so if you are experiencing diarrhea and you need to make up for some of the, you know, the the losses, um, when it comes to like things like Gatorade, those even though they have electrolytes, they're also very high in sugar. So I would choose one of those like IV kind of repletion where that you get the electrolytes without the sugar. Um, I'm forgetting the brand right now, but you can just make sure that the one you're choosing is not going to be high in sugar.
Great. Thank you, Elaine. That it looks like we've answered most all of the questions. Thank you for all of you who participated in questions. There's also a very active chat box we have for the individuals that can view the chat. There's definitely some nice suggestions from other members in the audience giving suggestions. Thank you for those ideas there. Just lastly, I want to thank everybody here for attending. Of course, a big thank you to our speaker, Elaine. This was a very informative presentation. This recording will be posted, sometime around next week at the Health Library under the lectures and events under the Diabetes Care Program. As a reminder, the webinars are on the second Thursday of every month at 5 o'clock. And we hope you can join us for next month. The next topic is going to be preconception planning offered with Dr. Bassina. So thank you so much for joining us today. We look forward to seeing you next month.